All right, welcome to Society, the podcast. It's your host, Dr. Oso. We have a very special segment for y'all today. I'm here with my very good friend.
I'm David Foreman. I'm an ear doc in Houston, originally from Jamaica. Oso and I went training together, so that's where we met, and the relationship has been solid ever since.
Absolutely. So, like I said, we have a very fun segment for you guys today. A lot of people always ask us, what's the craziest thing you've seen? Mm-hmm. And so we're going to go into ER stories. So basically stories from the vault. We have a lot of stories built up in our memory bank, but we're going to give you some of our favorite ones today. Yeah. What do you think, David?
The crazy thing is we get this question often, I'm sure Oso does too, from non-medical folks. And, they ask, what's the craziest thing you ever seen, Doc? And it takes me like minutes to kind of answer that question, because on a day-to-day basis, we see what we see. We've been doing it for years now. Facts. And it almost just feels normal. Yeah. But to the non-medical folks, that's like crazy. So it takes a second to think about that question. But you do have a few stories that kind of rise to the surface.
Absolutely.
Because, there's some unforgettable ones for sure.
There are definitely some unforgettable ones, man. And so, like you said, sometimes we have all these traumatic stories that sound crazy. And when you say it out loud, you're like, oh, I guess that is pretty crazy. But to me, it's just like, I see this every day, right?
That's right. I might see tomorrow.
Ain't right, no telling. Exactly. Ain't no telling. So, man, we're going to go right into it, man. So I'll go ahead and start, man. So it was a Friday night. We're at a really busy trauma center. And,
it's a Friday.
The Friday nights, you always know something crazy is going to happen. It's just a matter of when. That's right. And so I remember, we get the pager that goes off, the level 1 trauma, whoop, whoop, whoop. Mm-hmm. And then we get the paramedics get in there, all right? And, we get a report, okay, what's going on? All I see is this lady screaming. Mind you, I'm an intern. I don't know anything about anything. I'm still trying to figure out where the bathrooms are. And so they bring her in and they're like, okay, we got this lady. She's a 30-something-year-old woman. She just had a breast job done in Mexico. And I'm like, okay, that's fine. Yeah. And so she's saying her left breast is like about to explode. Yeah. You right? And her blood pressure was like 80/60. I'm like, okay, that doesn't sound great. All right. Yeah. So we get her on the bed. Mind you, the lady's just screaming her butt off. Like she's just like, can't console her at all. Right. So we give her some pain medicine because she's in so much pain. So, ABCs, we all that airway, breathing, circulation, and then we expose her, and sure enough, we see her left breast is like huge. Like it literally looks like it's about to explode. It's red, it's angry, and again, her blood pressure is like down the drain, right? So we're like, okay, she must have some type of hematoma or abscess, something. Yeah. So we go ahead and start blood products, right? Because we're assuming it's a bad bleed, right. Operation gone wrong in Mexico. And so we go ahead and call the surgeon, because we know we're going to have to get her to surgery, right? So evacuate whatever's going on. I kid you not. We leave the room for 5 seconds. Within that time, the nurse calls me back in. Dr. Oso, come back in the room. I literally see a volcano of blood gushing from her boob. And it's just going everywhere. Like, it's all over the place. It's on the nurse. And again, I am like out of my element here. I'm still trying to figure out if I can order Tylenol in the system, right? And so I just like go into survival mode. I just put my hand on it, right? No gloves, right? I don't recommend that. I didn't have any gloves on, but I just put my hands on it, trying to just stop the bleeding. I just feel the gauge on my hand, and my hands are bloody. Scrubs are bloody. And so I said, go call my attending. We got to get this lady to surgery, stat. Mm-hmm. So I just hop on the bed. The nurse starts pushing the bed out the room.
The bed
with me on holding compression. Mm-hmm. Mind you, the surgeon has no idea what's going on, right? So we get to the OR. We like, hey, we need a surgeon. They were able to get in contact with one. So they just meet us. They're like, okay, go to OR 4. We go to OR 4. This lady is like pale in the face. Like you can see eyes rolling in the back of her head. And I'm like, oh my gosh, you about to lose her. I'm about to have to start doing compressions. Because I feel the boob like shrinking, but it's still like pulsatile bleeding. And this is all probably going on in like 5 minutes. Like everything happened so fast. And so finally we get her to surgery. They give her more blood products. They're doing like massive blood transfusion protocol where you're just pumping her with tons of blood because she's losing it. Mm-hmm. And pressors, the whole thing, epinephrine. And they got her to surgery, stopped the bleeding. And, many, many surgeries later, she recovered, thank God. But man, I will never forget that day. Like, I have a picture, not of the patient, but just of the room.
Wow.
And it's blood. It's like a pool of blood all over the floor. It's like at a level above the floor. Like, it's a lot of blood. Like, it's almost her whole
That's crazy.
blood volume.
That's crazy. No, the society needs to see that.
That's crazy. Yeah. I'm gonna put it on. I'm gonna put it on.
Oh,
It should be right here. But yeah, man.
That's crazy.
How about you, man? Let's see. I know you got a good one.
Wow. That's crazy. That's crazy that you knew to put pressure on.
I mean,
as an intern.
Yeah.
It's kind of instinctual. You just do what you think needs to be done.
Right.
Something
And that's what we do, man.
Yeah. A lot of it is just, again, ABCs, and once that's covered, you do what you think is necessary in the moment.
Right.
It may not be the cleanest, but
But
you do what's necessary.
But look, we're not plastic surgeons, all right? We're here to stabilize and keep you alive. That is our job.
That's right.
All right.
So my story was I was a third year in residency.
Okay.
Level 1 trauma center.
Cool.
It was a Friday night shift, but it was heading into the morning. So it was, Saturday early morning, 3, 4.
Witching hour.
Yeah, the Friday night craziness has calmed down.
Right.
And so, I was kind of wrapping up my patients and kind of ready to sign out. At around 4:30, we got a call saying that there's a psych patient coming in, but they have eye pain. And so in my mind at that time, as a third year, I'm just so focused on like disposition, need to be efficient. So in my mind, I've already created a plan before seeing the patient.
Got it.
Medical clearance, get psych to see them, admit or discharge.
For sure.
And so EMTs bring the patient in, he's in the gurney, one arm on the armrest, the other, so arms on the armrest, legs crossed, eyes like this, chilling. And I'm like, okay, all right, ready for the story. He's like a middle-aged African-American male, was kind of seen by the side of the street acting erratically, bystanders call, so we got involved. And so when we got there, he was saying, I took my eye out. The crazy thing is, like, patients say the darnest things.
They do.
And, psych patients, you can't believe every word they say.
Right.
There's a reason why they need the medicines that they have.
Yeah.
So, he says that, and they bring him in. And so they give me the story. He's hemodynamic disabled. Again, ABCs. He's good. He's talking. Right. Tell me his name, but his eye like this. So I says, sir, what happened to your eye? He said, I took it out. I was like, all right, come on, sir. Why would you do that? At this point, I think I'm joking with him.
Right, you're like joking.
Like,
yeah.
Why would you do that?
Like, no way he did that. Yeah.
So he said, I was just angry. I was like, I'm sorry to hear that, boss. I introduced myself, tell him I'm going to help in the best way I can. And again, he's cool, chill with it. And so right before the EMTs left, he says, oh, doc, by the way, we found this right next to him on the grass. And so they hand me this jar with saline, and there's a little circular thing that was white.
No.
With about 3 inches of a cord attached to it.
Oh my gosh.
So I looked at it and I was like, that kind of looked like an eye, but
Ain't no way.
I'm not sure about it. So I start examining him. Again, the eye's like this.
Yeah.
So I said, sir, I'm going to look at your eye, okay? So I go to like peel the eye open. Blood. Just blood. Not squirt, but just blood.
Oh my God.
And so then at this point, I was like, wait, this guy
really pulled his eye out.
So I took a look back into the jar. The globe intact. You see the iris, and you see about 3 inches of the optic nerve.
How do you
attached.
even do that?
The worst part is there's little shards of grass in there too.
Oh, that's crazy.
So
Ain't no way.
think about it. Your fingers are as big as they are.
That's what I'm saying. I'm like,
And
how
so
do you
how do
get
you-
up in there?
and take it out whole.
No, that's crazy.
And so
That's a magic trick. That's some David Blaine stuff.
bruh, I go back to him and I said, sir, why did you do this? You know that this might not be reversible. And he said, I was just very angry. I'm just not having a good day.
The fact that he's just talking to you matter of fact is crazy.
Right.
Like he's just like,
Legs
yeah,
crossed.
that's what I did.
Yeah,
Like this is he do this every day.
I was pissed.
Oh,
I was
no.
like, okay, all right, okay, sir. So again, our responsibility in the emergency room is medical evaluation. There's a medical issue here before he can be evaluated by the psychiatrist. So I got my again, we get the ophthalmologist involved. They were even in disbelief when I told them the story as part of the consult. And so they came down, saw the patient. Again, they agreed that thing in the jar was an eyeball, and it wasn't where it should be. But at that point, there's not much you can do.
Yeah.
You know, you can't reattach that.
Can't reattach that, no.
You know, for since then, that guy has been his world of view has been cut by 50%.
Oh yeah.
He's
got the patch on for life.
Yeah. So he got antibiotics, cleaned out the socket,
Yeah.
created a clean wound, and that's his life from here on out. So
That is
again,
crazy.
I think the society needs to see that too. So
Yeah, they do.
if it passes approval, we'll show you a picture of that too.
That's crazy.
But
That's crazy.
yeah,
All right.
guy removed his eyeball completely.
That's wild. All right. So I got one more story for you, man. That story's gonna be hard to beat because that's pretty crazy. But I got one more story. So it's another trauma night, right? You know how that goes.
Yeah.
And so we get another level 1 trauma page. You know, I really had PTSD about that level 1 trauma pager because I hear it in my sleep till this day. I've been out of residency for like 3 years, and I still have traumatic dreams about that level 1 trauma pager. So we get a pager, and penetrating level 1. That's all it says. I'm like, all right, cool, whatever. Probably got shot or something like that. Wrong place, wrong time. So we get paramedics come in, whoop whoop. And we see this guy. It's a Japanese guy, and looks pretty young, probably in his 20s, 30s. And they're like, yeah, he got stabbed, right? And so he comes in. He just got a non-rebreather on. He's got a blanket over his whole body. And they're like, yeah, he got stabbed in the abdomen. I'm like, okay, cool. You know, we see this all the time. People get stabbed every day, you know? So we get him, ABCs. He's talking, breathing. Blood pressure's good. I'm like, all right, cool. Bread and butter. Probably got a little stabby stab, you know, see that all the time.
Yeah.
So we get him undressed. We take the blanket off. Bro, guess what I see under the blanket?
What's that?
His entire bowels and intestines are just sitting out. They're just hanging out. They're just out there. Just hanging out like, hey guys, it's me. Like all of his intestines and his stomach.
He's talking.
He's talking. I was like, whoa, this ain't just a stab wound. Like he has eviscerated bowels outside of his body. And so I asked the paramedics, like, what happened? And they're like, oh, he's in this Japanese gang.
Oh, by the way.
And they, by the way, and they got there was a gang fight. And they were like, he got stabbed with a katana, a sword.
Bro, I thought
What? In Houston, Texas?
Only on TV.
I was like, okay, I heard of like Bloods, Crips. We got a Yakuza gang in Houston? I was not aware. I need to be afraid of swords now, right? So, man really got sliced by a sword, okay? Bowels are out. Thank God vitals are good. He's talking.
Wow.
He tells us, he verifies the story. I was in a gang fight, and I indeed was sliced by a sword, right? I'm like, what, y'all having like a sword out? Like, I'm confused. I've only seen this in movies. Like, so, at this point, again, I'm probably like a second year, I think. And I've seen a lot of stuff to this point, but I ain't never seen this. And so then I'm just like investigating his intestines. I'm like, is there any cuts in the bowels? And so thankfully
You're a surgeon now.
Yeah, there wasn't. Everything seemed to be very much intact. So he got very lucky because, you know, obviously if the actual intestines was punctured, that's a whole different story. I mean, mind you, this is also an emergency, but you know, we got him to surgery pretty quickly, and then they packed his intestines back in, sewed him up, and he was good as new.
He's a lucky man.
And he was good as new. But that was just crazy, because just the mechanism of what happened, I was just like, I will never forget this ever.
He's a lucky guy, because, you know, long sword to the abdomen, and your gut is intact.
That can be it.
That's pretty
Look,
good.
in anime, that's a done deal.
Yeah, wow.
They cutting you in half, you know? RP Gojo.
No, that's wild.
Yeah.
Again, that's the thing. And you can see that any day, anywhere, anytime.
Yeah.
And, you know, you got to do what you got to do.
People don't know this stuff is happening in the streets,
That's
man.
right.
That's why I stay inside. That's why I stay inside. I don't go outside. I don't go to the club.
No, I feel that.
But
You know, you're definitely right about that wrong place, wrong time, and it can happen to anybody. And, you know, a lot of times what I think of is that, you know, you hear this on the news, and folks outside of medicine may hear this story, but they hear it 2-3 months from the time it happened.
Yeah.
We see it 2 to 3 minutes after it happened.
Minutes,
we
yeah.
see it 2 to 3 hours after it happened, and so it's it's a crazy experience day to day. But I enjoy it. It keeps me young.
It keeps you on your toes for sure. You know, you never know what you're gonna get. People always ask me why ER, and I'm like, man, I just love the randomness of it. You know, 1 second you're treating toe pain and COVID, the next pain you got a Yakuza gang member with sliced bowels. I mean, you can't make this stuff up.
Never a
can't
dull
make this
day.
stuff up.
Never a dull day. So, another story that kind of stuck with me. I got again in residency. This was on the medicine side though. I was second half of second year. So again, I felt like I had a good grasp of the medicine.
Yeah.
And I needed to start working on efficiency.
Right.
So the next chief complaint was nose pain. So I saw it was a young female nose pain. So I thought, okay, easy.
Yeah.
It can't be that drastic. Antibiotics, go home. That's it. Mind you, this was my second year, which is like around COVID. So
Right. Oh yeah.
I walked into the room. She has a mask on.
Okay.
So I introduced myself, and I asked her what brought her to the ER today. She said about 3 weeks ago she went to Colombia to get nose fillers, and about a week after that, she noticed some redness, some discoloration that made her concerned, and so she had contacted the provider that did it, and she was started on antibiotics and told to continue that, keep it clean, it'll be fine. About 2 weeks after the surgery, so this is a week after that developed, she said it wasn't getting better on antibiotics. She felt like it was getting worse. The tip was getting darker. There was some redness around the area. She didn't have any fever or anything. She was able to breathe fine.
Yeah.
But it made her concerned.
Okay.
At that point, she's back in the United States now because she lives here. She just went to Colombia for the procedure. And so she's messaging the provider on WhatsApp. And so the provider is like, don't worry about it. Come back to Colombia. We'll take care of it.
Come back to Colombia because that's so easy.
This is normal post-surgical stuff. We'll be able to take care of you.
Of course.
At this point, she's getting a little hesitant and a little less trustworthy of the provider. So she decides to come to the ER for a second opinion. So her vitals are fine. Again, ABC is good. No bleeding, just dark nose.
Okay.
She goes to she proceeds to lower her mask. Again, this is like peri-COVID.
Yeah.
I don't know how she got to Colombia. Peri-COVID. Lower her mask. The entire nose is black.
Oh.
She has a little bit of erythema towards the edges of the blackness, and then some like pockets of pus.
Oh no.
And
Her nose is done.
I was like, so to be honest, I wasn't really familiar what a nose job is, nose fillers. So I asked her exactly what it is. She says they take this material, it's injected into the nose to contour it to your desired features. And so I figured we got to start antibiotics. I got to get my ENT specialist involved because this don't look right. She's on antibiotics, it's not getting better. So there might be something more going on. I got a scan of her face just to make sure there's no abscess deeper that needs to be drained. Right. And so the ENT got involved and they said that what this is pretty common post like nose fillers. What happens is that they inject this material into the nose to contour it, but sometimes it can get into the artery or vein. And wherever there's no blood, tissue dies, infection develops. And so that darkness was all dead skin. She had a little bit of redness further back. That's just infection.
Yeah.
And this is a lady that clearly cared about her appearance. Again, she had her breast. She had her breast done. She had her butt done.
Oh man.
She decided to get her nose did. And the nose is the center of your
face.
Yeah, center of your appearance to anyone.
Yeah.
And so there's some medicines that they tried to like break down the material that they put in the nose.
Right.
That didn't work. They continued antibiotics, didn't work. They even went to as far as hyperbaric oxygen, which is like
Hyperbarics, that's some big
for society folks, it's just like forcing air into a tissue to help increase chances of healing.
Oh my gosh.
That didn't work. And so, if she eventually was admitted to do all of that, she was discharged and followed up. And she had to see a plastic surgeon because all that tissue was dead. Yeah, so she had to get it reconstructed.
She had to get a brand new nose.
Yeah, brand new nose. Yeah.
That's
from nose fillers to
no nose to black nose to Rudolph the Red Nose.
That's right. To a created nose. So
oh man.
people have their reasons for doing what they do.
Yeah.
I would just caution everybody or anybody who is willing to do that. Just be
Right.
careful.
Just be careful,
Just be careful,
right?
'cause-
Do your research.
Yeah.
I understand a lot of times, especially nowadays, it's so popular, right? So a lot of these plastic surgeons, the price is very high. So
Yeah.
they get, their friend tells them, you can just go to Mexico, you can go to Colombia, you can go to
get it much
Venezuela,
cheaper. Yeah.
way cheaper.
Yeah.
But guess what?
Yeah, it comes at a
It's
risk.
cheaper for a reason,
Comes
you
at a
know?
risk.
So you just got to really be careful. So man, that's crazy, man. So
Yeah.
I mean, that's some crazy stories. Hopefully we have learned, one, not to get plastic surgery by shady people.
Yeah.
Don't pull your eyeball out and
Get help.
Get help. Get help.
Yeah, if you
Better help.
Yeah.
Sponsor us.
If you have thoughts, if you have concerns about, how you feel,
Right.
reach out to a friend.
Reach out to a friend.
And if not a friend, a stranger.
Right.
I'm pretty sure that
There's
stranger
also-
will get you help.
Absolutely. There's also the suicide hotline as well. If you feel like you're feeling into depression, suicide, harming yourself, there's definitely so many resources out there in this day and age.
Yep.
Therapy is normalized now, thank God,
Yep.
for men and women. So please get help.
Yeah, for sure.
So yeah, man, appreciate you being on, man. Those are some amazing stories.
Hey.
Catch us next time on Society the Podcast. Don't forget to like and subscribe. It's been a pleasure. Signing out.
I got it.
Let's do it.
Yes, sir.